Welcome to the Produce Moms Podcast, where we believe there is a produce mom in all of us. I'm Lori Taylor, founder and CEO of the Produce Moms. For 10 years, I sold fresh produce to over 300 grocery stores in the U.S. And today, my team and I are fully focused on inspiring people to eat more fruits and vegetables. This show is just one of the ways that we hope to inspire you and your family to eat more produce and live a better life. If you like what you're hearing on the podcast, join our community of almost 40,000 in all 50 states and over 30 countries by visiting theproducemoms.com/subscribe. And be sure to subscribe and leave us a review on iTunes. Thanks for being here. Enjoy today's show. Welcome back, everyone. This is the Produce Moms Podcast, and I am so excited to be joined by two distinguished guests today. We are welcoming two gentlemen that really serve in capacities of supporting our growers, and I've gone on record many times saying on this podcast and through our other platforms at the Produce Moms, I wholeheartedly believe that the two primary stakeholders in the entire supply chain and food and beverage industry are the farmers or the growers, as well as the end consumers. So it's really great to welcome these two gentlemen who just dedicate their professional life to supporting our growers. And our first guest today is Chris Valadez. He is the president of the Grower Shipper Association of Central California. He's based in Salinas. And then we also are welcoming back to the show Dante Galeazzi. He is coming to us from Mission, Texas, and he is the president of the Texas International Produce Association. So Chris, Dante, say hello. Chris, we'll start with you.
Hello. Thank you, Lori, for having me on. Very, very excited to speak to you, be on with Dante, and I just dialogue and engage, I think, on some important matters and experiences that we have, particularly from our stakeholder base for us, notably out of the Salinas Valley. So it's definitely been an experience, one we've learned a lot from, one we've evolved through this pandemic along with everybody else. And so I look forward to kind of sharing some of our accounts with you today.
Thanks. You know what? And I realized too, as you're saying hello and that what we're going to talk about, we didn't really say what we're going to talk about in the intro. So this is a really important episode, you guys, because we're talking about the COVID-19 vaccine and what our industry is doing to make sure that our essential workers in agriculture have access to it. So Dante, with that, please introduce yourself, say hello, and any opening remarks.
Absolutely. Howdy. Thank you for having me. So I'm based in South Texas. Texas was really kind of unique. We were at the tail end of our production cycle in March and April when the pandemic first broke. So our growers were really in the thick of their season when they had to adjust, and so were the workers. That meant all kinds of scrambling and adaptations. And so now here we are entering our season again, which starts in October, runs all the way through May and June, is really kind of the bulk of the South Texas season. So our growers are again encountering this situation, and with the vaccine on the horizon, we're really excited for it. So as you can see, I have a guest joining me here, so I apologize.
No, that's all right. Say hi, little man.
Say hi, buddy.
Hey, no, that's pretty special. He's our first kiddo who's joined the show. So
yeah. Yes, you can have a cupcake. Go get a cupcake.
The work from home. It's so real for us all. So Chris, let's get started. Let's frame up the current state for folks. I think it's probably pretty important, especially after our preliminary discussion before the show, the timeline to access. Let's make sure we touch on that as well. But what's the current state? I mean, the COVID vaccine is here. We're seeing it on the news. It's rolling out. We're seeing that, other essential workers are getting it, primarily in the healthcare industry. But what's your point of view here on current state?
Yeah, I think there's optimism, but I admit there's also a bit of confusion. I know, like Dante's scenario in terms of, dealing with the onset of the pandemic and where they were at in their season. Ours, we were front end, right? So we were starting this past March and been kind of throughout the entire duration of the pandemic, managing through the challenges that the pandemic has presented. And so, there is reason for optimism because now we are starting to see in a very visible way the deployment of the vaccine for critical healthcare and first responders and other folks that have been prioritized in the first tier. Here in California, though, there are work groups that have been established by the state public health department to prioritize, other sectors, other groups of persons who are critically vulnerable or deemed necessary to be prioritized. Agriculture, farm workers, agricultural employees, we believe will be in a tier 1B. You have 1B. So they'll be in a second tier. It's been our opinion that, while we don't, criticize, critique, or think that, a nurse, a doctor, others who are day in, day out dealing with the COVID crisis are not a priority. They clearly are. They have been so integral to our experience here in the Salinas Valley with some of our COVID-19 programs we've managed in conjunction with the healthcare community. But to us, no less important is that of the agricultural employee who, without them and without the ability for farmers to continue to operate and do so as safely as possible with protective practices and following, public health-based requirements, if you don't have the backbone of this system, which is the agricultural employee, covered, protected, and vaccinated as one of your top tier priorities, then you really can affect the continuity of the food production system. And so for us, it's really a watchdog, it's really a bird dog, and it's really an advocacy effort, in addition to an infrastructure kind of establishment effort to see that when ready and available, that we can be there to help get the vaccine deployed and in the hands and accessed by a farm worker population, which in and of itself, despite the connection to the agricultural employee and the work site, can be a challenge just because of maybe attitudes, beliefs, concerns where there could be vaccine control or deployment that's maybe government centered, which is not all bad, but if it's so centralized, you may have a problem with maybe acclimation or fear in taking access through that type of avenue versus maybe, more familiar or more friendly or more trusting type avenues, which could be, kind of clinic in conjunction with the agricultural employee, work site based vaccine deployment events, things like that, which while diverse, I think can give us all in the agricultural community much more hope over the fact that you can access agricultural employees and that you can deploy the vaccine in an environment where there's already a set of built-in trust. And to me, trust is really important throughout all of this.
Oh my gosh, it's at the cornerstone of all this. Go ahead, Dante.
Lori, if I can add real quick, one of the other things that I want to talk about regarding the importance of getting the vaccine to the farm workers, regardless of where they're at, is the human element that's involved here. And that's that many of the workers that we have that are in the fields or the packing sheds or really all the way up through mid-management, they're really the folks that they've got both the mother and the father are out there working, and they depend on that paycheck and they depend on that revenue coming in. And through the pandemic, there's a good chance that half of that paycheck has been gone because someone has had to stay behind to stay at the house with the kids or family members or what have you. And so the sooner I think we can get the vaccine to these folks, the sooner that we will see both of them be able to return to work, get the kids back into school, and hopefully get what most Americans are starting to enter, which is a financial debt crisis, because they've been so long without being able to get the money or the income that they expect or that they've been able to earn, prior to the pandemic.
Yeah. And, Dante, you and I really got to know each other through work in DC, political action to support this industry. Myself focused on child nutrition programs, specifically USDA school meals, and yourself focused on, farm worker labor and other on the farm issues beyond the child nutrition programs. But I have to imagine, especially with the vaccine being something that has been deemed and promoted as, this will be free to folks. And there was a, complete public-private partnership that expedited the development and the deployment of it. Is there political action happening right now from an agriculture perspective to make sure that our farm workers are going to be on this 1B tier?
Yeah, there absolutely is. I can say that at the national level, we're seeing groups like United Fresh, American Farm Bureau, U.S. Dairymen, U.S. Cattlemen Association, all the big players in the ag space have come together. You don't have separate voices. You have one voice going to our elected officials at D.C. and the highest levels saying, this is why we believe that after the people in the healthcare space, after our first responders, like police officers and the ambulance and firefighters, after the vulnerable communities like the elderly and those in nursing homes, after you've reached those people and we start looking at the essential workers for critical infrastructure, agriculture should be one of those high priority groups because of, the access that they have in general to healthcare, because of their dependence on the dual income, because of what Chris was mentioning, that it's so vital to maintain the food that Americans need to eat. And so we rely on this workforce. We rely on the supply chain. So not only is it happening at the national level, but it's also happening at many state levels. I know that here in Texas, our Texas Ag Council, which is made up of, like TIPA, the Texas Citrus Mutual, the rice growers, turkey growers, cattlemen, et cetera. We are working within our state as well to amplify that message. I know California is doing something similar, Florida, Arizona, Michigan, all the big ag states. We're really trying to make sure that we get out there and that we have these discussions with our elected officials. Chris did a really good job outlining the supply chain and really kind of the backwards application of the vaccine to get it down to our farm workers. We've got to make sure that we're having those conversations now, today, with our elected officials, and not, 36 hours before they say, okay, you guys are going to get the vaccine. How do we do it? So
yeah,
there's a lot of those conversations happening.
It's so important. And I've even learned a lot listening to both of you guys talk just through the last 10 minutes. I would have answered this question, which I want to get both of you to answer here in just a second. But the question is, why is prioritizing agriculture employees for the vaccine of critical importance? Why is that so important? I would say because food security is national security. And I've learned that by hosting this podcast and talking to so many stakeholders that have taught me, like, hey, if we're a food secure nation, that's not just national security, but it's human security. And we can't have our industry be shut down anymore and disrupted any more than it already has been due to the pandemic. So, Chris and Dante, you both have obviously shared great remarks, but Chris, just one sentence, why is prioritizing agriculture employees for the vaccine important?
I think for us, you said one sentence.
Whatever. I mean, there's no rules here, but you know what I mean? Like a concise statement, like a power statement is what I'm getting at here.
I think for us, it's the agricultural employees, they're the backbone. Without them, we do not have, let's just say, a national food system. You do not have that. We are an industry that, because we were deemed essential, we were needed in order to continue throughout the midst of the pandemic.
Right.
In so many ways, I'm sure some operations were just one step away from kind of significant challenges, problems that in some cases either A, disrupted their ability to continue, or B, because they were able to, work aggressively and employ the practices, the measures that they did to operate while reducing the risks connected to the work site, we were able, by and large, to see, little to minimal disruption in the food supply here.
Right.
So it's important to me, in addition to, important groups like, for example, I'll give you nurses or doctors. There, theoretically, you can have a vaccine deployment in a hospital that's well managed by the hospital to cover all of their staff. For me, it is also critically important that we recognize, with the population we're talking about, in some ways, you have to do more to embrace, to incorporate, to engage, because it's going to be harder. Even once they are prioritized and the vaccine's available, it's going to be much more difficult to get the vaccine administered to this population, which is why if we don't, as a society, as a nation, as states, as federal, state, and local health departments prioritize and find a critical role for the agricultural employer, the farmer, to help as that magnetizing kind of center, bringing the employees to one site together.
Right.
If you don't use the farmer to help with the deployment, I think the vaccine will be there. I think the prioritization will be there, but the access to the vaccine, I feel critically, will be lacking unless you use and partner with the farmer who has been there every step of the way, working hand in hand with their team members, the employee, to make sure that they are continuing to produce food. It's critical. You have to use the employer here.
Yeah, for sure. Dante, anything to add to that?
Yeah, absolutely. First off, Chris, great response. Couldn't agree with you more. I was sitting there wanting to clap the whole time you were going, yep, that's it. But I'm also going to talk about the other stakeholder group that you talked about, Lori, consumers. And the word I'll give them is economics. If the American consumer is already challenged to pay their monthly debts as it is, if the ag workforce doesn't have a vaccine and we continue to lose workers, that's going to impact the supply of food available for Americans. When the supply of food goes down, but the demand is still there, what's going to happen? Prices are going to go up. That's the last thing we need in America right now is our food to be more expensive. So I think that's really a very basic and easy concept to understand. We've got to get our workforce vaccinated so they can keep putting food on American tables so we can keep feeding people without that cost going up.
Right. And as we talk about our workforce, is this program and this Tier 1B access to the COVID vaccine, will that include our H2A farm workers?
Yeah, to my knowledge, it should not be discriminatory. So if you're an agricultural employee, which is very broad, it would be inclusive of anyone who's here at that time, which would be a guest worker around that coinciding period of time to receive the vaccine. So yes.
Good. All right. So what happens if food sector employees are not interested in getting the vaccine? Do you think they'll still have jobs?
Absolutely.
Has there been discussion about that? Like, is it going to be something that's mandated? Is that going to be up to each individual employer? Is that, what are your thoughts, or what do you know from your members?
My thoughts are that it's probably going to be a to be determined type scenario. I don't see how legally you're going to require the workforce to get it. I think it's going to be highly encouraged. I think you're absolutely going to have holdouts. I mean, even within the regular brackets of American society, we have holdouts for vaccines like chickenpox and whooping cough, meningitis. You take your pick. So I think we are going to have holdouts when it comes to the ag workforce. That said, I think a vast majority will sign up, will participate, are probably ready to jump in line and throw their hands up and say, please, yes, me. But I don't see where we are going to, as an industry, say, if you don't have the vaccine, you're out. I don't think that's feasible from one point. I don't think it's legal from another point. And third, I think that we are in a situation now where we need every laborer we can get. Yeah. So it doesn't make sense to further deteriorate that pool of candidates, in my opinion.
Yeah. I would add, Lori, I think, if this was, for some reason, if this was the beginning of the pandemic and, we had a situation where there was just a lot of unfamiliarity, no experience, I could even see it a lot more hesitation on the part of the average person, let alone an agriculture employee, about, well, what vaccine, do I even get a flu shot every year? I can see a lot more hesitation. And in some ways, there could be a rhyme or reason behind that. But at least here in this region, our agricultural operations, the employee experience itself, I don't know anyone who hasn't been touched in some way, shape, or form, whether directly, indirectly, someone they know, someone, connected to them. And so I think, the opportunity that results as a result of having experienced this pandemic for many months now is, I would hope, a lot more sensitivity over the seriousness of the disease, whether you're symptomatic or not, how it could affect people in known and unknown ways. And I think for the employer, I don't know. I agree with Dante. I don't see kind of a punitive scenario being set up as a condition. I just don't know. But I would hope, more on a kind of on the spirit of it basis, on the basis of the spirit that, both employers and employees are in this common point of seeing together, they're not being able to improve from their operation to their own personal economics.
Right.
You really don't have an opportunity to make progress through and out of a pandemic unless somehow you can secure you're no longer at risk. And for us, I don't know what other tool that exists to really reduce, if not eliminate, the risk unless we are vaccinated at a higher clip, where maybe at the end of the day, it might not be every employee, but you might have, just like herd immunity on a community-wide scale, you might have it at a company-wide scale where 70, 80, 90+% of the workforce in some way, shape, or form has access to the vaccine.
Yeah, so well said. Thank you. So what other, prior to this, I know because I've been keeping an eye on the trade journal and, speaking to so many of our dear colleagues in this industry. So I know that there are an abundant amount of measures that have been taken since March 2020 to date to help protect and prevent the spread of COVID-19 among farm workers. But I'd love to give both of you an opportunity to share more from, your boots on the ground insights and anything else that you would like to say about, just applaud your members and talk about what's happening in your regions to help prevent the spread of COVID-19 thus far without the vaccine until the vaccine's been developed and deployed. So Dante, we'll start with you.
Yeah, so as I mentioned, Texas was in the thick of our season when March 2020 came around, and we did not have a lot of information. We knew that this thing was viral, probably spread very similar to the flu. So the Texas growers, I have to applaud them because the growers and shippers responded almost immediately. They went out and they were building partitions between people on lines. I saw setups where they had shower curtains dividing people. They had plastic partitions. They had wooden partitions. Literally anything they could get in there. They started doing temperature checks. They implemented hand sanitizer at every spot. They were sanitizing people's uniforms and shoes and gloves, masks. It was this en masse response that everybody took, and they didn't ask who's going to pay for this. They just started doing it. Now, later on down the road, they said, hey, we could really use some help. We just invested $20,000, $30,000, $40,000 worth of safety equipment in there, and there's no price increases on our product. If anything, we probably have less product because there's less places to sell it.
Right.
So there was a ton of measures that went in, and there's still new measures going in today. I heard that there is a packing house who is implementing not only temperature checks, but they're doing a blood oxygenation test as well, where they check to see to make sure that not only is the temperature, in line, but that you don't have another possible one of those underlying symptoms.
Right.
We've also seen a lot of people move workforces virtual or put them in shifts. So that way, if they do have a COVID outbreak, they don't lose all the operation. So we've seen some very unique solutions. We've seen some very obvious solutions. And I know Chris's folks have basically worked the whole time, so they've probably got a whole lot more creative solutions than us in Texas. But I can say for sure that we are very welcoming of the vaccine coming. We're very welcoming of all the new science that continues to come. More than anything, though, I think we're very welcoming of the fact that more and more people are understanding the critical nature of this virus and are responding by wearing their masks, wearing their gloves, observing social distancing, and really being very smart about, hey, you know what? I don't feel well. Don't know if it's a cold or the flu or COVID, but I'm not going to take the chance.
Yeah, doing the right thing for sure.
Yeah. That's right.
Chris, what about any remarks from your point of view in Salinas?
Sure. No, very, very similar in many ways to Dante's experience from the production sector there in the state of Texas. And here, some of the uniqueness I think was born out of necessity, quite frankly, at least in our region, what coincided with the onset of the pandemic in March, where you had kind of, at least on the vegetable side, transition out of Yuma back into the Salinas Valley here anyways around that time. You also had, as Dante identified, you really had an absence. It was just a, kind of a societal lack of readiness. There was an absence of guidance on, okay, what do you do? What does this mean? How do you address it? And so, In March, our association partnered with others and with county government, quite frankly, throughout our 4-county region here, just to put together a best practices guidance based on what was publicly available. So a compilation of, from CDC to state health departments to local health departments, really just we got to have a baseline.
Sure.
It has to make sense at a base level for most, if not all of these operational settings. That's not just a work site. It could be inclusive, and you asked H2A, could be inclusive of an employer provided housing site or a transportation unit where the employer is transporting large
Very good
groups
point.
of persons.
Yeah.
From point A to B. That wasn't there. And so we had to kind of create it and get it endorsed by county health departments. And it kind of lived until, your more official infrastructure caught up from a public health perspective, and they created their own guidance and requirements. You also had here something really unique, because this is a region where, I don't cast any blame, but this is a region that's very expensive to live in for all of us.
Right.
There's a lack of available and a lack of affordable housing that affects everybody. Disproportionately, affects many folks who work in agriculture who are connected here in this region to the agricultural sector, which is probably at most about a third of all the jobs here are somehow interrelated to agriculture. And so because of that, what does that mean in the midst of a pandemic? Well, what we saw that it was starting to mean really quickly is because of a crowded or congested personal living condition, if people were ill, regardless of where they caught it, in the community, spread elsewhere, they're going home, spread is being exacerbated. And so what we did at the Grower Shipper Association, and only because of our employers, doesn't work because we thought of it, or we thought it was a good thing to do or a necessary thing to do. It worked because agricultural companies, folks who are in the business of feeding the nation.
Yeah, these are the businesses behind the brands you all see in the produce department.
They also identified, because of this condition, if we don't set up our own housing and our own nursing and our own feeding program to be able to take those people who are positive or exposed, get them out of a congested or crowded environment, wherever it be, in their own personal home or in a dormitory style living condition elsewhere, and put them up for about 2 weeks so that they are no longer infectious while serving all of their day in, day out needs, from medical to just basic necessities, we will never have a chance to get even close to catching up to being effective on reducing further spread or transmission of the virus. That was a program that we started here and became operational early April. And we've operated this housing program free of charge for farm workers. Employers are paying for it. And again, these are brands, these are companies that are in the business, in this case, of producing fresh vegetables and fruits for all of our enjoyment. But on the back end, in order to help themselves go and do so in a way where they're keeping their employees as safe as possible, understanding that they don't have the cure. They don't know how to solve this. This is a worldwide problem.
Right.
But what they decided to do was kind of be extraordinary in this moment and provide housing so that where there is testing, where there is tracing, it's also followed up with isolation so that we can reduce the exacerbation or the further spread of the transmission, keeping not only them, but their housemates or their family members kind of safe or at a lower risk for catching the virus. And that's kind of the untold story that we've had and we've lived here. We haven't done these.
I must say, I didn't even know about it until now.
It is significant. And what we don't know, and one day we might look into this, like how many people likely from a public health statistical basis did not get the virus because not government, and there's nothing wrong with state or federal partners or healthcare officials, but because these companies that produce food that we all buy in the grocery stores, they did this.
The farmers paid for it.
Significant.
Wow. Yeah. What a story. I had no idea. I'm glad you shared it. Thank you. It's remarkable. Well, gentlemen, this has been such a great episode. I mean, I've learned so much. I've mostly learned that my passion, and I've been saying, I always say this, and I've had to remind myself of this just like on a daily basis in 2020, but I do believe best days are ahead. I always have, I always will. And for sure, as we wrap up our conversation on this episode, I'm full of hope. and optimism. And I think that's so important for everyone that's with us today listening, and for everyone in our industry. I hope that you find yourselves as inspired by these two gentlemen and the work that's happening in Texas and in Central California and throughout our entire United States in the agriculture sector. So with that, Dante, I welcome you for closing remarks, and then Chris will have you sign us off from the show. Okay.
Yeah. So I'll make mine quick. I think just a couple things to take away from this, which is that we cannot stress the importance of getting the vaccine to everybody, and really the value that that's going to bring to the world. But specifically when we talk about the ag workforce, getting the vaccine to these folks, getting the vaccine to these workers that are putting food on American tables every single day, cannot stress what that means to the economy, to the society, to the world. So that's really where we come from when we say, hey, after these key groups ahead of us, we would like that our elected officials, whether it's state or federal, recognize how important it is that the ag workforce get access to the vaccine. Other than that, I just have to say, I got to make the plug for our industry. People at home, you cannot eat enough fresh produce. Now is the time. Fresh produce is good for you. Doesn't matter if it's greens or fruit or apples or bananas. You got to get the vitamins that are in there. You got to get them into yourself. You got to get them into your families. There's no better medicine for you and your loved ones than fresh produce. You can't eat enough of it. You can't eat too much of it. Go to the store, get that extra apple, get that extra avocado, get that extra head of lettuce.
That's right.
Now is the time to really, really up that consumption and up your vitamin intake.
Awesome. Following that, I think, here we're thankful to be on the Produce Moms and speak to the trade, speak to your audience, but speak to consumers. And at the end of the day, not everybody's trade, but we are all consumers. And I think what we are learning, what we've seen, and hopefully we can grow and evolve from as we transition into vaccine and how well we do it and how effective we are as a result of receiving and deploying the vaccine for this critical sector of ours, is we are all in this together. And I think the consumer does have a significant role here. I think from their continued patronage and selection of products that are grown here, that are produced here, that support kind of the backbone we all talked about. I think that's critically important. But what's also important in that, I'm in a region in California that's coastal. It's coastal agriculture, central coast of California. Ag, by and large, while it is greatly impactful onto the region's economy, if you look at it on the totality, just in the state of California, it is the minority. In our state, we are a minority here in terms of just our numbers and possibly in terms of influence as well, just because it's much more urban as opposed to rural. And at the end of the day, we are close to an urban area, but we too are rural. It's very important that consumers, wherever you are, whatever your thoughts are, these aren't political issues. This is just general humanity. I'll use Dante and kind of bring in the human condition for it. This is just general humanity. And so, I don't ask for preference. I don't ask for any special treatment. I just ask that we all can kind of get around a common cause. And we have been, and that's if we're going to continue to progress through this, that we can do so in a way that makes sense by keeping those who are most vulnerable and or necessary for a greater good, such as the production of food, that we can kind of share in the advocacy and promoting their prioritization, because it's important for all of us. If you ask me, Chris, or a ranch manager or somebody out in the fields doing the work, who should be first? You'd think selfishly I should say myself. Not at all. I should actually be last. I should masking, sanitization, isolation. Other people should be first. And I would just hope we have that spirit about us that let's let those that should be first actually go first.
Thanks for joining us on this episode of the Produce Moms podcast. If you or someone you know would like to be a featured guest, just send an email to Lori@theproducemoms.com. We know there is a produce mom in you because there's a produce mom in all of us. Join our community on Facebook and all social platforms. Help us change the way America eats. Thanks again for listening, and we'll see you next time.